building on this belief, the Spanish Red Cross and the French Red Cross have launched 7 months ago Red Social Innovation, a resource center of social innovations coming from the Red Cross, Red Crescent movement, but also from social entrepreneurs, private partners, or other NGOs. So we can inspire each other in the ways we respond to today's vulnerabilities. The solutions-oriented approach of the platform has really the goal to understand how things are concretely done on the file. And in that, the Spanish Red Cross, the French Red Cross, and other national societies have a lot of experience in order to facilitate the sharing of best practices. And even though we are well aware that solutions will necessarily evolve from one geographical context to another.
So this gathering will be the first of a series of several 35-minute events that will occur every 2 months in order to shed light and test on tested and proven solutions coming from the Red Cross and Red Crescent movement, but also from external actors such as private groups or social enterprises. Today's the topic of the webinar is around food and medicine delivery and what is often referred to in the private sector to as the last mile. We will listen to 3 pitches, 1 of the Italian Red Cross and 2 from social entrepreneurs, and then dedicate 15 minutes to question and answers. So please don't be shy and write your questions in the chat along the way. And so the speakers will be able to answer to you at the end of the pitches. Before that, I'm honored to introduce Eric Nee, the editor-in-chief of the Stanford Social Innovation Review, which is a partner of Red Social Innovation, and will be briefly introduce the topic of today. So Eric, the floor is yours.
Well, thank you, Julio and Anna, for your introduction. The work that you're doing at Red Social Innovation is so important, and Stanford Social Innovation Review is thrilled to be able to partner with you in helping to bring new ideas and discussions about social innovation to the Red Cross and Red Crescent community around the world through events like today's 45 minutes webinar. And I think it's appropriate that the first topic that 45 minutes addresses is the last mile problem. That's because it's one of the most difficult and long-lasting challenges that we face. How do we overcome the physical, social, economic, and cultural barriers that all too often prevent needed products and services from reaching people? But of course, the last mile problem is not new. It's been with us for a long time. But the global pandemic has certainly heightened everyone's awareness of the issue. It's not a problem that exists only in remote rural communities that don't have physical infrastructure like electricity or paved roads, healthcare clinics, refrigeration, or cellular service. It also affects people living in dense urban areas who, because of social and economic barriers like poverty and racism, also may lack access to essential goods and services. I think it's also important to understand the last mile problem is not something that's confined to less developed countries and regions of the world. Of course, the problem is more acute in parts of Latin America, Africa, and Asia, where so many families, both urban and rural, lack access to essential services. But it also exists in countries like the United States. So I'm talking to you here from Palo Alto, one of the wealthiest parts of the United States, but just a few miles away from where I live, there are people living in food deserts who, if they don't have cars or the money to pay for something like Instacart, don't have access to fresh fruits, vegetables, fish, and meat. Many of the homes that people live in those areas don't have broadband internet, and their only access to healthcare is to try to get to the emergency room of a hospital located many miles away. And as Julio said, the last mile problem is not confined to the social sector. In fact, if you think about it, many of the most successful tech companies that have come out of Silicon Valley here and other parts of the world, created in the last decade or so, have been built around solving the last mile problem, but solving it for the middle and upper class. So we have companies that deliver food, clothes, cars, I mean, anything you want directly to your door. Companies like Tencent in China, Amazon in the United States, Swiggy in India, or Food Panda in Germany. Many of these services boomed during the pandemic as people were required to quarantine or stay at home to minimize the transmission of the virus. But these high-tech services are directed at people who are relatively well off, people who have broadband internet to their home, who have laptops and smartphones, who have the money, importantly, to pay for the delivery of those products and services. But what about those who can't afford these services or who live in areas where they're not available? That, I think, has been the challenge that we faced, particularly during the pandemic over the last 18 months. How do we get food to people who are hungry? How do we get people vaccinated who can't take time off of work or get to a clinic? How do we educate children who can't attend school but don't have broadband to the home? How do we make sure that the elderly or disabled who are confined to their home get the services that they need and deserve? So the particulars vary from country to country, but some of the core barriers are often the same. In some instances, it's the lack of physical infrastructure like roads, the internet, clean water. In other cases, it's economic barriers. People might not have jobs, or the jobs they have aren't paying them enough. In other cases, it's the lack of a social infrastructure. Governments choosing not to provide basic services like education and healthcare. And in other cases, it's social barriers like racism and sexism that exclude people from having equal access. But despite these barriers, there are nonprofits and NGOs who have met the challenge of overcoming the last mile barrier during the COVID epidemic. And we're going to hear from 3 of them soon. And I'm anxious, just like everyone is, to hear what they have to say. But before we do that, I've been asked to talk about just a couple of examples of organizations that we've reported on in Stanford Social Innovation Review that have done something similar. So let's first start by remembering what it was like, dial back 18 months ago or so when the pandemic first hit. We weren't certain how the virus was transmitted or how virulent it was. We only knew that it was spreading like a wildfire and people were dying at alarming rates. So the initial response in many countries was to just shut down. And what happened when things shut down? Children could no longer go to school, public transportation stopped, stores were closed, people couldn't go to work. And importantly, many NGOs were hit as well. In some instances, the services they were providing people could no longer be done in person. In other cases, people no longer needed the services that these organizations were providing, but instead they needed new ones. So these organizations had to adapt. They had to pivot. They had to innovate. So let me give you an example of one. It's called Education Superhighway. This nonprofit in the US had spent the previous 8 years helping bridge the digital divide by bringing broadband internet to schools and classrooms, public schools and classrooms that did not have those services. And in fact, they largely succeeded, connecting public primary and secondary schools that served about 43 million students to broadband internet around the United States. They were actually getting ready to wind down their operations and declare a victory, which you don't see many nonprofits actually doing. But then COVID hit. So suddenly, all the work that they had done to bridge the last mile, in this case, bringing broadband to the classroom, was for naught. Many of the children who attended those same schools did not have broadband connections to their home. And so when the school shut down and these children were told to learn remotely, they were in effect being abandoned by the public school system. So rather than shut down as they had planned, Education Superhighway pivoted and started a new program. They did this in literally weeks with a whole new goal and new funding to get these children access to broadband internet, and importantly, to an education outside the classroom. So a couple of things they did. First, they created Wi-Fi hotspots in the community by working with some of the same broadband carriers they've been working with to bring broadband to the home. They also started to investigate ways to bring subsidized service broadband to the homes of low-income people. They partnered with companies like Sprint, interestingly outfitting school buses that were no longer being used to transport schools. They took the buses out into the community with with pretty powerful Wi-Fi systems and park them in central locations so households could get internet. Of course, that's not a realistic long-term solution, but it was something they did like right away. At the same time, working to figure out how to get broadband to the home for these children. And they're still doing that. They've completely changed their mission to focus entirely on that. So let me mention just quickly a second example, and that's an organization called BRAC, the very large global nonprofit based in Bangladesh. They've been operating in that country for decades, and they have a deep reach into the communities that they serve through a variety of institutions and programs. And when COVID hit, the Bangladesh government imposed a lockdown that had a devastating impact. 85% of the population of Bangladesh earns less than $6 a day, and 90% of the jobs are in the informal economy. So when the country locked down and prevented people from working, millions of people were suddenly without any income. And without income, they basically didn't have access to food. So to address this, BRAC launched a cash transfer program to reach the most vulnerable people in the country. They did this, they thought about doing a food distribution program, but they decided to do cash because they believed it would be quicker to do, more efficient than distributing food. And also because it gave people receiving the aid the option of what to spend the money on. Maybe food wasn't their biggest issue, maybe it was medicines, maybe it was electricity. But because of the lockdown, it wasn't feasible to hand out money in person. You couldn't set up a pay point and have people easily get to it. And if they did, they wait in long lines. It would increase the risk of infection. And there was an actual security risk in having staff out there in the community with large amounts of cash handing it out to people. So instead, BRAC turned to digital cash transfers using a phone-based app called bCash, which is similar to Venmo and PayPal. And they were able to do this quickly because bCash is actually a subsidiary of BRAC Bank, a bank that BRAC had set up some time ago. They started with a pilot program reaching 242 families. They quickly scaled it to 6,000. By June, they were reaching 170,000 families. And by the end of 2020, they had reached 600,000 families. But among the challenges they had to overcome were these. Almost half of the adults in Bangladesh were unbanked. They weren't at BRAC Bank, they weren't at any bank. Only a third of the targeted population used bCash. Close to 20% of families lacked a phone. So BRAC had to innovate, they had to improvise. They identified trusted neighbors and relatives who did have a phone. They launched a campaign to sign up those with phones for bCash. They trained people how to use bCash. They also trained people about the advantage of using a digital wallet instead of converting it to cash. So these two programs, they didn't completely solve the problem. Millions of people in the US still lack broadband internet. Millions of people in Bangladesh are still poor and not able to make ends meet. But both programs did help people, and they did it by bridging the last mile. So let me just summarize by saying a couple things. What did they do? Both of them used resources that they had. Education Superhighway had connections already with the broadband internet companies that they've been using to bring internet to the schools, and they pivoted to thinking about how could they use those connections with companies to bring broadband to the home. And bCash looked at an e-banking service they had called bCash and thought about how can we make those resources but use them differently by using them for cash transfers instead of for those customers to use it for their own banking. They both acted very quickly and they weren't afraid to experiment. So I think those are some of the lessons that these two organizations provided, and I'm really interested in hearing about what the other three organizations that we've got here lined up did during the pandemic. So now let me turn it back over to you, Julia.
Thanks for the inspiring lecture, Eric, and thanks for giving it in the early morning in California. We move to Italy now because it was the first country hit by pandemic in Europe. So I would like to introduce you to Marta Maraude from the Italian Red Cross. She will tell us more about the challenges of the last mile during the first year of COVID crisis in Rome and in Italy. Up to you, Marta.
Yes.
Okay.
Yes. Hi, everyone. Thank you, Giulio, for giving me the floor. It's a great pleasure. It's a great pleasure to share with all of you the latest activities carried out by the National Response Center and to give you an overview of our food and medicine delivery service implemented to fight isolation during COVID crisis. So thank you again for your participation and support. I just mentioned the National Response Center, but what does exactly the National Response Center refer to? The newborn structure has been established with the purpose of creating a junction point to connect the various activities carried out by our association. I'm sorry, I'm just switching the slide too fast. Okay. So citizens can directly call the center through a toll-free number to have access to the services we offer, like health transports, home delivery of food, medicines, and food parcels in case of financial needs. Our operators collect all the details of the request and sort it to the user's closest local branch. Among the 600 branches spread throughout the territory. With the help of more than 160,000 volunteers, the citizen is called back So with the help of more than 160,000 volunteers, the citizen is called back to arrange for delivery. To carry out the service, the local branch can directly deliver groceries or drugs for users in self-isolation or not self-sufficient, or set up a delivery hub where to address the citizen. And this happened when the restriction made by the government have been reduced. If not able to carry out the service, users are addressed to third parties, such as social services, municipalities, or other home delivery services entitled to satisfy users' needs. And finally, the local branch reports the outcome of the service in our software. Let's have a look now to a few numbers related to the activities carried out in 2020. The calls we received were more than 280,000 and led to the activation of 55,000 services, among which almost 38,000 have been directly carried out by Red Cross, and only 2,400 have been redirected to third parties. And last but not least, the services that our local branches carried out autonomously have been more than 300,000. But among the National Response Center activities to fight isolation during the pandemic, there are also other services, such as the phone companionship service addressed to elderly people and people who suffer solitude. The user is called 2 or 3 times per week to keep him company and listen to his needs. In addition to that, a new version of the service will soon be launched, thanks to the support of an Italian telecommunications company. Using tablets, the users will be able to get in touch with each other in virtual squares, where the conversation flow will be mediated by our operators. Another project also involves the so-called telehealth system that consists in remote monitoring of users' vital signs made by our operators and eventually managed by medical personnel previously identified. In addition to that, another recent activity we're carrying out is a customer satisfaction analysis that aims at obtaining feedbacks useful for the provision of services from our local branches and getting new suggestions for a non-stop improvement. So this was just a short overview about the activities we're focusing on to relieve suffering during the pandemic and to face the population need. I hope you enjoyed the presentation, and we'll be open to any question you might have during the Q&A session. Thank you again for your participation.
Thank you, Marta. Really nice to hear about this initiative. We are going now across the Atlantic to discover a social enterprise that was created during the pandemic. In New York City, here is Eva Kerner, founder of Welfare.
Eva, the floor is yours, but your mic is off.
I love Zoom. So great. So hi, everyone. Thanks for joining us from all over the world. One of the beauties of sort of the last 2 years is that we can now come together like this rather comfortably. So I'm co-founder of Welfare, and I think that it's probably best if I actually do this. There we go. Glad we're all on the same page now. So Welfare is a nonprofit that is bringing healthier snacks, drinks, and pantry goods right into the heart of New York City's low-income communities. Now, when you consider food insecurity, images of food pantries and hungry children often come to mind. Statistics like 54 million food insecure and 1 in 6 children worrying about where their next meal is coming from are also top of mind. However, what 2020 really shone a light on was a much more gruesome epidemic that the United States has been facing for a much longer period of time. That 78% of COVID patients hospitalized here in the US were overweight or obese. 75% of the lives that were taken by the virus were also overweight or obese. So in recent years, the US has hit a rather uncomfortable milestone. It's the first time in our history that the majority of our population is overweight, and at least one, and the majority of our country suffers at least one chronic diet-related illness. And these are illnesses that are the most preventable and costly to treat. So this speaks to a much larger reality that the United States doesn't really have a hunger problem as much as it has a malnutrition problem. And what we should be thinking about is what the food that we're actually putting into our systems is doing to us today and in the future. And what we're doing with Welfare is thinking about how we can do a little bit better. So raising the standard of health and well-being for low-income communities requires first and foremost an understanding of what the current standard actually is. And it's grim. For low-income communities, these are drowning in junk food because here, cheap ultra-processed food is 3 times more prevalent than in wealthier communities. And food and drink that is astronomically high in salt, fat, and sugar is quite deadly. So despite a desire to eat better, families on a budget are forced to stick to a junk-heavy diet to make ends meet. And more often than not, going to low-cost grocers and corner stores like these. So the cost of that is that low-income residents are 5 times more likely to develop a chronic illness and pay 5 times more in healthcare costs than wealthier residents, trapping generation after generation in cycles of chronic illness and poverty. Now, once you see these 2 images, the following slide will demonstrate a little bit of a different reality. Because in healthier areas, or rather in wealthier areas, there's a wellness boom that is in full swing. Every day, new better for you alternatives to traditional sort of grab and go convenience favorites are popping up on the shelves of Whole Foods and other health focused grocers that are peppered across the nation. Many of them are driven by convenient nutrition, not simply produce. Emerging manufacturers are reimagining candy bars and chips and sodas by replacing sugar, added sugar, saturated fats, and unhealthy preservatives with rich proteins, probiotics, and complex carbs. They've normalized what it means to eat healthy on the go. And it expands the confines of nutrition beyond the produce aisle and beyond the dinner table to make healthy, easy, fun, and tasty, as long as you can afford it, which is where welfare comes in. So we saw an opportunity to bring all of these innovative goods into low-income communities in a convenient, reliable, and affordable way. So earlier this year, we launched our direct-to-door program. So every 2 weeks, we deliver a box, much like this photo, filled with $200 worth of non-perishable, healthier snacks, drinks, and pantry goods directly to low-income residents living in public housing and on federal assistance programs. In addition to delicious and convenient nutrition, we include information on the nutritional benefits of the food that we deliver to inform our members as to the food that they're eating and its impact on their overall health. So to recap, our boxes are filled with food that meets our strict product standards and requirements. We provide a sense of security with consistent bi-weekly distribution of food rather than being a flash in the pan solution. And finally, and perhaps most importantly, is we educate people as to ways that they can improve their health by simply making a phone call to welfare and signing up for our service. Now, how does this actually work? We have forged strong partnerships with some of the nation's most innovative food and beverage companies, for many of which we are the primary social impact partner. They ship their donated products to our warehouse, the image on the left, where our volunteers pack them into boxes, and then the image on the right, distribute them every 2 weeks like clockwork to residents of over 20 public housing developments. Now, how does a household sign up for our service? What is this simple phone call that solves all these issues? Well, they call our 888 phone number found on posters that we've placed in lobbies of public housing developments and throughout the community. We onboard them by learning their current state of health, if they're receiving government assistance, and what the makeup of their household is overall. This, ladies and gentlemen, is a sea change to what other local nonprofits are doing, but because we're collecting data about our members and learning about their wants and needs to better solve for their challenges, much like what we just learned about the Italian Red Cross's solution. In addition to a direct-to-door program, we are currently testing an outpost distribution approach, where we'll be distributing boxes at strategically placed public locations that are nestled in between this network of public housing developments to which we currently serve. And what's the overall impact? Impact, very big word in the nonprofit space. Well, when one person signs up for welfare, the entire household feels it. When Nellie, the household breadwinner, can eat a healthy protein bar instead of ordering fries at the diner she works at, she feels better at night when she can come take care of her dad. Her anemia and her blood sugar are kept in check. What happens when an immunity gummy tastes exactly like a Sour Patch Kids, but instead of being made with corn syrup, it's made with a superfood, with Manuka honey? Not only does grandma love it, but the kids do too. And when a mom spends hours on her day off running from store to store looking for the best food for her baby girl, knowing nutrition awaits her across the street means that they get to spend more time together, and she can rest assured knowing that they have the best food available to them. Not only have our boxes given us an opportunity to nourish an underserved population, but it's also showed us that given an affordable and a convenient choice, people will always choose to live healthier. And all of this has been made, kind of brought to life by an exceptional team, by our board of directors that have had sort of a really large impact, and they come from this for-profit world that is dug into the food and beverage world, into the innovation, and with our incredible army of volunteers that come out every 2 weeks to be able to pack and to deliver these boxes. And they themselves help build out and affect the strategy of the way that we're building out our service. So with that all being said, thank you so much for listening.
Thank you, Eva. And Now, to finish this cycle of pitches, we would like to introduce a social enterprise that was launched almost 10 years ago to distribute life-saving medicines to isolated people, taking advantage of the logistics of a private company, Coca-Cola. I will let Simon Barry tell you more about his organization, which is called Call Alive. Simon, I think you should open your mic as well.
Sorry, that was supposed to be slick, but once I've shared my screen, I couldn't access my unmute button. So let's try again. So hopefully you can hear me now. Thank you for the introduction, Julie, and thank you for the invitation to speak. My presentation is slightly different in that it's not COVID related. I've got 5 minutes and I'll use that, the first one of those minutes to introduce Cola Life and the other 4 to make 3 points about what we've learned while innovating in the last mile distribution of medicines. Cola Life was established in 2009 and has worked to increase access to the WHO recommended treatment for diarrhea, oral rehydration salts and zinc. Today, about 500,000 young children die from diarrhea each year. And so 5 will die during the duration of this presentation. It's the second biggest killer of under 5 children, and only 15% of cases get the recommended treatment. We know from decades of research that there is a direct link between access to ORS and zinc and child mortality. The more children that get it, the fewer die. It's a simple numbers game. The first point I wanted to make is what you think is an innovation might actually not be. This is about being open to change, failing fast and moving on. We and all our supporters at the beginning thought that this was the innovation, co-distribution of a co-pack containing ORS and zinc with Coca-Cola. The logic was extremely simple. Coke gets everywhere, so if the co-packaged ORS and zinc was in the same crate, that would get there too. In the process of agreeing this co-distribution idea with the Coca-Cola company, we learned a lot. We learned that the reason Coca-Cola gets everywhere is because people really want it. Most can afford it, at least occasionally, and the people satisfying this demand, the manufacturer, the distributors, the wholesalers and retailers, can make money from satisfying this demand. So the key is aspirational product design, aspirational marketing directly to the target customer, and the creation of a value chain that works for everyone involved. In our trial, thousands of co-packs reached remote rural areas, but only 4% traveled in Coca-Cola crates. So we ditched the co-distribution idea. Given that product design is so crucial to this way of doing things, creating demand, so that people can buy what they want, I thought I'd just show this video of the actual product design. This is a prototype that was filmed about 4 years ago, and it's a co-pack designed for the Zambian government. It contains 4 ORS sachets, which are small, and 10 zinc tablets. It contains an instruction leaflet, which also carries the branding. This is branded as the government product. The packaging can also be used as a measuring device. Our early research showed us that very few people know what a litre is or what 200 mils is. So this pack actually measures that water. You only have to do that once, of course, because once you know where it comes to on your glass, then you can do it straight into the glass. You add the ORS, it's orange colored, which is important, it's orange flavored. You give it a stir, and you give it to the child. My second point is that to have an impact, an innovation cannot stay as an innovation. It must move into the mainstream and become the new way of doing things. When we came to consider how we might globalize our impact beyond Zambia, which is where we did our initial co-distribution, co-packaging trial, we realized it was going to be very resource intensive if we were doing what was seen in every country as an innovation. So we switched strategies completely and decided to put our very meager resources into trying to change the global policy environment. We worked with others over a 3-year period to persuade WHO to change the recommendation for diarrhea treatment to co-packaged ORS and zinc, and we succeeded. So now our offer has changed. Instead of going country by country, trying to persuade each one to try out an innovation developed in Zambia, our proposition now is, let us support you in the implementation of the new WHO diarrhea treatment recommendation. And my third point and last point is you need to advocate. Changing global policy is one thing, but change is nothing in itself. The recommendation that children should get ORS and zinc goes back 17 years to 2004. And as I said earlier, today only 15% of cases get this treatment. We are determined that the new co-packaging recommendation won't suffer the same fate. For this reason, we're establishing a global network called the ORS Zinc Co-Pack Alliance, or ORSCA, and we would urge you all to join. Numbers are really important. You can sign up on the link in the chat. I wanted to end by returning to the last mile theme of this event by saying why co-packaging is so crucial in the last mile delivery of the global recommendation for diarrhea treatment, ORS and zinc. We know from 17 years of practical experience that while ORS and zinc are procured separately, supplied separately, distributed separately, they are very, very rarely dispensed together. Co-packaging changes all of that. It ensures that both elements of the recommended treatment are available at the same time at the end of that last mile. I'm very happy to take questions, and thank you very much.
Thank you, Simon, for your pitch. Very inspiring indeed. Maybe I've seen a few questions from Gabriela about how welfare has been financed and how they did attract many volunteers, knowing that the welfare was a brand new social enterprise. So maybe if Eva, you can answer to that on the camera.
Absolutely. So I answered it in the chat, but I can sort of speak to it a little bit more. So first and foremost, the way that we've been able to attract this many volunteers is through Volunteer Match, which is a platform that connects folks that want to volunteer here in New York City with organizations that actually offer those opportunities. Interestingly enough, there's not very many opportunities that offer work, that offer events on the weekends, which honestly I find a bit strange because folks that are working during the week can't then kind of take time off to go do good work, or at least it's a lot harder for them to justify that. And so what our opportunities allow is it's every 2 weeks, every 2 Saturdays, we invite folks to come in to distribute boxes, and then we're actually quite a bit more flexible when it comes to packing them. So we work a lot with our volunteers' schedules and have them come over to our warehouse and be able to do the packing. And often when people come and do the actual volunteer work, there's a lot of movement, there's a lot of meeting new people. There's also a lot of meeting folks that they're not often able to meet and have interactions with. So it's in addition to being a fulfilling sort of environment where they can see the impact directly of the energy that they're putting into this, into welfare, but it also allows for them to create new friendships, to create lasting connections, and also something that folks can do on a pretty regular basis. So it creates a bit of a routine. So we have volunteers that come regularly, whether it's, you know, every 2 weeks or every month or every 2 months, so on and so forth. And then when it comes to our donations or how we finance our services, we keep our overhead quite light, in that all of the products that we're actually bringing in are donated by these emerging food and beverage brands. And so that would often be the largest cost. And so outside of that, in order to essentially cover our storage and cover our personnel, so on and so forth, what we're able to do is we're able to go to our individual donors and to foundations that fund work in our space to be able to cover our costs. Thank you for that question, Gabriela.
Thank you, Eva. Maybe I have one more question for all the people that are joining the webinar. It was quite inspiring, the lecture of Eric, and I was asking myself, what should we learn from corporates like Amazon or Coca-Cola when we talk about fighting last mile in social ed? What should we steal? What should we copy of these corporates, of course, in our context?
Perhaps I can come in here. A key learning point for us when we were setting up our trial, our co-distribution trial, was that what the private sector do, the Amazons and so on, is that they are in the business of supplying what people actually want. Now, that is in contrast to the health sector, or a lot of the health sector, which is characterized by delivering what we think people need. Now, if you set up to deliver what you think people need, there is no demand there necessarily. And so you have to push the product or service out to them. And that is a completely different model and much more difficult to implement. So I would suggest that, you know, ministries of health around the world aren't failing. They've just got a really difficult job. It's much easier to energize existing distribution systems than it is to create and maintain distribution systems yourself. I mean, Eric touched on it in his introduction. He talked about BRAC giving people cash. And why did they do that? Well, so people could buy what they wanted, not what BRAC thought they needed. And of course, by doing that, you energize the local system that's already there, the local entrepreneurs, the shopkeepers, the people on bicycles distributing stuff. And it's a much more potentially sustainable solution and much more resilient to, you know, changes in systems. I'll stop there.
Thank you so much, Simon. There's a question raised by Therese, and thank you for being here, indeed. Have these initiatives stayed local or have been shared with other countries or Red Cross societies? Maybe Marta, you can answer to that from the Italian Red Cross.
Yes, basically we shared our initiatives, and for example, our project Cri per le persone has been reproduced from France Red Cross, and we also did a webinar to share our experience and our strategies to fight the pandemic.
Thank you, Marta. I shared the Croix-Rouge chez vous, so the let's say the homologue of the Italian Red Cross initiative in the chat, so that people can have a look at the website. And actually, it will be published this week on red social innovation. Do we have other questions?
Perhaps I could ask a question. How do the other speakers see the, how would they go about increasing their impact? Is it about growing the organization and growing the system that they've created? Or is it about actually changing other systems to operate in the way that their systems now operate? Sorry, difficult question.
So Simon, I'd like to take a crack at that. I think it's a little bit of both. At least that's what we're attempting to do. So first and foremost, you know, it's as hard as it may be for my co-founder and I, we know that we need to focus we need to double down into the community that we're present in to be able to understand, as you'd mentioned, the needs of the community rather than assuming we know what they are. And that means having in-depth conversations with a subset of our members to understand the whole image of what sort of the challenges that they face on a daily basis are in respect to their nutrition and the financial means that they have to actually access nutrition on a regular basis, in addition to these healthier snacks and drinks. What that will allow for us to do will allow for us to start building a better understanding of their overall health, and then informing local healthcare providers as to what these individuals are actually doing to better their health by accessing a service such as welfare. And so that'll have sort of downstream effects, and that's ultimately the desire that we have, is to have that larger impact within the communities that we're serving, rather than simply, you know, providing food. So that's the first thing. The second thing that we're trying to do is we're also trying to essentially elevate the conversation that we're having with the people that we're working with on the operational side. The operational side being with the food and beverage brands that are donating product to us. We want them to not only see us simply as a depot for excess food that they may have in their production line, but also to understand that the folks that we're delivering to are essentially a new health conscious customer market that they simply haven't been able to speak to and haven't truly addressed. And the majority of their marketing doesn't speak to that consumer. It speaks to a consumer that is already aware of what it means to eat healthy. So there's not a lot of newness there. There's not a lot of real innovation and really pushing the needle forward. And so by introducing their products to this new, essentially health conscious consumer, again, we're increasing the standard of health and well-being in the entire consumer market and the consumer packaged goods market, or at least that's the impact that we'd like to have.
Thank you, Eva.
Thank you for that question. It's not often that we get that.
Well, as we promised, the idea of the webinar is called 45 minutes. We are 57. So maybe I would like to thank you all for the participation, and we will send you back soon second invitation for the second topic of this cycle, which is about climate change mitigation. And yes, thank you so much for joining, and I wish you a great day.